Hello everyone, and welcome to this episode of CommYOUnity by Encompass Community Supports. I'm your host, Tammy Barboza, and welcome back. We are so thrilled to have with us many members of the team of Community Connections for Older Adults, and that is a division of Encompass Community Supports. To direct that division is Ray Parks, the Director of Community Connections for Older Adults. Ray, thank you so much for joining us today.
Thank you, Tammy.
You're
glad
welcome.
to be here.
Oh, and we are glad to have you here. So May is a special month for your division because it is Older Americans Month every May. What does that mean for our agency?
Well, our division within Encompass Community Support serves as the area agency on aging, plus transportation services. We abbreviate that AAA because that's a mouthful to say.
Not to be confused with the other AAA that many people know about, if your car breaks down, if you need a map, etc.
Correct. So for us, it's area agency on aging. And this year, a lot of emphasis is being placed on education and strategies to reduce social isolation. So the theme for Older Americans Month this year is Powered by Connection.
Powered by connection. No pun intended, or maybe a little bit, but that is a powerful theme.
Exactly. And we are working on strengthening our existing services as well as starting up some new initiatives to promote social connections for older adults.
Ray, you mentioned social connection. What does that mean, and what would be the opposite of social connection, for example?
Well, that's a great question. The area agencies on aging, the AAAs, really our mission nationwide is to promote aging in place or aging in community for as long as possible for older adults. And what makes that possible is not becoming socially isolated. There are so many negative effects to social isolation. They've been well documented. It's even been documented by the Surgeon General's report that a person who is lonely and socially isolated, it's the equivalent of smoking 15 cigarettes a day in terms of health impacts. So really, the social connection concept is anything we can do to help reduce social isolation for older adults. And that is bringing them into community and services to the extent that they desire it.
Could you share with our viewers some examples of how folks may become more socially connected? I know you have a lot of programs and services under the Community Connections for Older Adults division.
Certainly, and you'll hear about some of these with some examples from our different departments and service areas.
Great.
But it could be a congregate setting like a senior center. It could be an outreach program. We have some programs that target older adults who suffer from depression. So it can be information and referral to other community partners. There's a variety of ways that we bring our resources to bear on reducing social isolation.
And are fees charged to an individual for these programs and services?
Most of the services we offer under the Older Americans Act, they're administered under something called the Area Plan for Aging Services for our region, and fees are not charged. However, we do ask for contributions, donations to the extent people are willing and able. We're funded rather thinly on the state and federal level, so we depend on local resources, contributions, program income to make our services work.
Wonderful. And we'll have our contact information on the screen, folks, for anyone wishing to donate to benefit the supports for older adults here in our communities. Ray, I was remiss in asking you how long you have been with the agency. It's just been a couple of years, hasn't it?
29 years.
Can we round that up and say 30? I mean, just for the sake of the conversation.
January 3rd will be 30, but
That's
who's counting?
wonderful. That is wonderful. Have you always been in this division?
No, I actually started out in a division formerly called Community Support Services and worked on the behavioral health side of the agency for about a decade before transitioning over to aging services.
You have a very large team, if I may say. How many team members do you have within your division, approximately?
Around 54, 55 total employees.
And our agency has about 400 staff. So those working within Community Connections for Older Adults constitute a fairly large chunk of our employee base.
Right.
Yes. So for Older Americans Month, you mentioned that we are the area agency on aging, or the AAA, for our catchment area. What is that area?
We serve the 5 counties of Culpeper, Fauquier, Madison, Orange, and Rappahannock, better known as PSA 9.
PSA 9, not Public Service Announcement number 9.
Public Service Area.
Area 9, okay. And again, a number of team members, a few that we will meet here in the studio today during this episode of Community. Ray, the partnerships that we have with other organizations, coalitions, I know that you serve as the board chairman for Aging Together, for an example. Can you speak briefly about those relationships that we have?
Well, the collaborative way that we're able to deliver older adult services is really key to any of the initiatives, our existing programs and the new initiatives that we're getting ready to undertake. And it's one of the things I enjoy most about my work here is that it is creative and collaborative in a number of ways. And since resources are thin, you kind of have to have that in order to get things done.
Which is a great segue into asking you, as the director of this important division, what does Powered by Connection mean to you with regard to your work with the agency?
Well, I got a little bit of a sermon here, 3 Ps. So
okay, 3 Ps.
I came up with 3 Ps. The first P is the premise is that every AAA provides connections to helpful resources for older adults to meet their service needs. That's who we are. That's why we exist. It's a nationwide movement. Secondly, I would say the people who care. You're about to meet some of the representatives of our management team who I would say exemplify and cultivate a dedicated and compassionate workforce. My best days are when I hear one of our employees say, "I love my job." And it's fairly often. And from experience, I know that they say that not because it's easy, but because it's meaningful.
Yes.
So the second P is the people. And the third is the partners, and you alluded to that already. We work together with a shared mission to improve our communities for older adult livability and quality of life. So many examples come to mind, including Aging Together and their many partners, Senior Services Collaborative, the Regional Commission, local foundations, churches, and other providers are all a part of that. So Powered by Connection, in my opinion, is really all about relationships, whether they're professional, supportive, spiritual, even romantic, it all counts. That's how we as older adults live well, thrive, and remain empowered.
I love that. So to recap, the 3 Ps, premise, people, partnerships. Says it all, folks, but you have not seen the last of Ray Parks. So Ray, thank you for your time during this portion of our episode, and also we'll be reconvening here at the end of this episode to talk about other areas of interest for you, our viewers. Whether you yourself qualify as an older adult in our communities or you have a loved one who is an older adult, please stay tuned, and we are about to bring on a couple of team members of Ray Parks Division. And our next guest is Tony Browning. So Tony is the support coordinator supervisor for the Community Connections for Older Adults Division at Encompass Community Supports. That is a long title, isn't it? Tony, thank you so much for joining us.
You're welcome.
Oh gosh, it's great to have you here. May I ask you how long you've been with Encompass Community Supports?
I've been with Encompass Community Supports about 28 years now.
So Ray has been here 29 years, right, for the agency.
Yeah.
So you're just 1 year behind Ray. Well, we're talking about Older Americans Month, and that their theme this year is Powered by Connection. Could you share with our viewers what your role is for our agency and how Powered by Connections works within your role?
Well, I work with adults 60 years or older, and since I'm one myself, I know that connection is something that we all need, not just for family, but connection of people that know what you know, that have lived through what you lived through. And I think that to understand and connect with somebody is an important part of growing older and being gracefully aging in place.
And through the programs and services that you're involved in with Encompass Community Supports, how do you connect folks?
Well, my staff, I have 4 support coordinators and myself, and there's 5 of us, and there's 5 counties. And we do we get referrals from phone calls, emails, other agencies, and sometimes we have people that connect with us for themselves.
Mm-hmm.
And we put each person that calls, we put them in a secure database,
Mm-hmm.
and then we figure out what they need, what they've said they need, and we see if we can fill their need. And most of the times we can, but if we can't, we have a database that we can go to called No Wrong Door.
Mm.
It's a conglomeration of like 211, another one is Senior Navigator, and they have a statewide list of services and supports for veterans, caregivers, aging services, and things like that.
So I think what I'm hearing, Tony, is if folks or loved ones of folks who are interested in knowing if Encompass Community Supports can be of assistance, not to hesitate, to just reach out to us, and we'll have that information on the screen, our contact information. And if for some reason we cannot help them or we don't have the programs or services that they're looking for, that we will connect them.
We'll try to connect them,
Yes.
definitely. We definitely will.
Could you share with me an example of a reason why someone would call us?
Well, we know that people call for home-delivered meals, or for that they can't get a ride somewhere, or that they are lonely. We know that there are people turning 60 and 65 and getting Medicare and not knowing what to do. Now, our support coordinators have a unique program. Only our support coordinators administer this program. It's called VICAP. It's Virginia Insurance Counseling Assistance Program. And we help seniors that are getting Medicare go through the system, see what they need, what they have to do, what programs or what services would be the best for them, their insurance, so that they can get their insurance settled. They don't have to worry about it. It's confusing, and it really, really helps to have somebody help you navigate the system, and that's what we do.
Absolutely. It can be overwhelming for many people. They don't understand some of the language involved or some of the processes involved. So you help to break it down and make it user-friendly, understandable, right?
And then after we do, and we have that, it's called Medicare and You Handbook, and we've talked about it, they say, oh, now I understand what that means. And it really is a good feeling.
Absolutely. Tony, I know that there's so much more than just VICAP that your particular role addresses. Do you have any other examples?
Well, I have two programs that are coming up that I'm really excited about. It's called Virginia Farm Market Fresh.
Ooh.
And it gives you have to qualifying seniors, $50 worth of coupons that you use at the farmers markets. Now the farmers market, the farmer has to also be included in the program. And you can go to any farmer's market. The farmer that uses the coupons will accept the coupons and buy fresh fruits, vegetables, and herbs. You can't buy flowers, but you can buy these things that are grown in Virginia, and that helps with the farmer, helps them.
Yes.
It helps the seniors who, sometimes these seniors, if they go to the food bank or something, they don't get fruits and vegetables that are fresh. And
that's a wonderful program.
if you do, and another thing we do is if you can't go to the farmer's market, we have little mini markets at the senior centers. And the seniors, anybody, not just the senior centers, but anybody that has those coupons can go to that market.
That's a wonderful program. And was there a second one that you wanted to share?
Yes,
as
I
well?
do want to, and we've had this one for like around 34 years, but it's called Senior Cool Care. And it distributes air conditionings and fans to seniors that qualify. And it's also administered by AAA's, Area Agency on Aging. But the money comes from Virginia Dominion Power.
Fantastic. So a free, if one qualifies, a free air conditioning, room-sized air conditioning unit or fan
Will be distributed, and until the program closes, until we have distributed all the equipment, or October.
Wonderful. And if you are interested out there, anyone you know who may be interested, we will, again, put our contact information on the screen to learn more about that. It's a wonderful program, and I know it's a very popular program.
It is very
Yes.
popular.
And I believe it begins in May, if I'm not mistaken.
It does begin in May,
Yes,
and we're ready to set up getting the equipment ready.
Well, it's about 85 degrees outside today, so this is definitely air conditioning and fan weather. Tony, I want to thank you so much for
You're welcome. You're
being
welcome.
a part
I'm
of
glad
this
to be
episode.
here.
Absolutely, yes. And thank you for all of the great work that you're doing.
You're welcome. Bye-bye.
Bye. And folks, our next guest is Susan Walters, and Susan is the Manager of Health and Caregiver Support Services for the Community Connections for Older Adults Division at Encompass Community Supports. Breathe. That's a mouthful, right?
It is.
Oh, Susan, thank you so much for joining us today.
Well, thank you for having me.
Oh, absolutely. So may I ask what your role is within our agency and how long you've been with us?
My role, my predecessor's role actually was a little more expanded. When I came on board, they provided in-home services like personal care. We had the adult daycare up in Warrenton. Since I've come on board, those two programs have disappeared, but we've expanded exponentially in other areas. And I've been with Encompass Community Supports for just a little over 7 years.
Okay, wonderful. Past the 7-year itch, right?
Yes, and I'm still here, so I'm
There we go.
good to go.
Susan, you are a nurse.
I am a registered nurse, yes.
And how does that fit into your role within the agency?
Well, again, when I started, I had an adult daycare program, which a requirement of that was to have a nurse oversee that program. But since that program was removed from our services, we do now partner with Generation Central Adult Day, so I duplicate that role with them. And my other programs that I oversee, it's not really hands-on clinical nursing as much as it is health related. So a lot of my background comes to play in resources, being a go-to person for my staff who are out in the field, seeing folks with different chronic diseases and issues.
Thank you. And Susan, of course, May is Older Adults Month and a focus on older adults for this month. how the theme this year is Powered by Connection. What does that mean to you within your role?
Well, everything that we do, every program that I oversee, basically we are providing supports and services to older adults. So we are connecting them with as many services as they need. If they're not served at all, we're trying to find those who aren't served and give them services. If they're underserved, we're trying to close that gap. So every program, we're connecting them with something, whether it's chronic disease self-management education, Healthy Ideas, which is targeted toward identifying and decreasing symptoms of older adult depression. And then our latest program, Mobile Outreach, which is really targeted to connections, started last year, and it's kind of boots on the ground, beating the bushes, looking for folks that just don't know we exist and what we have to offer. So we have been taking my program manager for that and planting her to make inroads in a lot of different communities and organizations that might have inroads into places that we don't typically, such as EMS, physicians' offices, hospital discharge planning, case management, and then plus all our other partner organizations.
It's the awareness of all of the programs and services that Community Connections for Older Adults has that we are trying to get the word out. Because if people don't know what we offer as an agency, then they don't know to call us, to contact us.
And that's the crux of the problem. I mean, we have so much to offer folks, and it's free, and they just don't know it's available. So I think some of it too, thank goodness, in this small community, even though we're spread out rurally, there's a lot of word of mouth, which is good.
Absolutely.
We kind of struggle with social media because we're also trying to connect older folks with technology that might not necessarily have it. But again, that's where it comes into getting the word out to bigger organizations that might have more touching base with folks like patients and users of some organizations that are aware of us that maybe that client isn't.
Susan, you mentioned chronic disease self-management program. That is a very long title. Let's break that down for our viewers. What does that mean?
And I understand the title, but I wish it wouldn't say disease. It's more like chronic conditions, and we all have them. I don't care if you're 21 or 91. Everybody has something, and it's a workshop designed for folks that may not have the best handle on or understanding of how to manage their chronic conditions.
And examples would be diabetes.
Yes, pain, diabetes, high blood pressure, congestive heart failure, COPD, it can be anything, arthritis. And the goal of the whole program is to empower a person to be able to manage more of their chronic condition and ultimately keep them from having to go to the hospital. That is our main goal, is to keep people healthy and keep them from ending up in the hospital.
Is this a free program?
It is. It is a free workshop. It can be done in person, in a group setting. It can be done virtually. COVID made us way aware of what we could do virtually, so we've kept that component because some people prefer that. It can be done by telephone, and there's even a kit component that's kind of a one-on-one. So we have a variety of ways to deliver the program. We're trying to meet the need of everybody.
Yes.
And it's evidence-based. It is proven that it will result, if you follow the program, it will result in positive health outcomes.
Wonderful. Thank you so much for you and your team's work, Susan. I know it's a huge endeavor, but I love all that you're doing, and your division as a whole is doing amazing work not only during Older Americans Month, but throughout the year.
Yeah, well, we're glad to do it. My whole team is just very gung-ho, very proactive. Couldn't ask for a better first line of defense out there.
I vouch for what Susan just said. She has an amazing team out there. They are go-getters. They want to help people. They want to care for folks, and they want to improve the lives of many older adults out there. So,
Yes, we do.
yes. Thank you again, Susan. Always a pleasure.
Thank you.
Hello, folks, and our next guest is Shelby Blankenship, and Shelby is the transit supervisor for, you guessed it, Community Connections for Older Adults Division of Encompass Community Supports. Shelby, it's always great to see you.
It's nice seeing you too.
Thank you, thank you. So how long have you been with the agency?
I've been with the agency for 20 years.
20 years. 20, 28, 29. There's a theme going on here.
It is.
Yes. Have you always been in transit?
I have. Yes, I have.
Okay. So when the word transit comes into my mind, I know about the agency, of course. So transit means a lot of things, right? To a lot of different people. In our world, for the agency, what does transit mean?
Transit means we transport. We transport people from all areas. We transport 5 counties. So what we do is we transport to the senior sites, which is 5 counties, which is Fauquier, Culpeper, Orange, Madison, and Rappahannock.
So you mean the senior centers?
Yes, the senior
okay,
centers.
great.
Yes. And we also transport to Bridges, which is for older adults
Okay.
who have an intellectual disability or developmental disability. And we also transport for Dead Lake down in Opal, Virginia.
Ah,
We transport them and they get them out in the community. And we deliver frozen meals. So we deliver them to all of our 5 counties as well.
would that be the home delivered meals program?
Yes.
Okay,
yes,
great,
That would be
great.
that. So what we do is the drivers take the clients their meals out in the 5 counties, and that's where the clients get their interaction with the driver, and that may be the highlight of their day
Oh.
because the driver may be the only person that they actually see.
So these are older adults that might be homebound, as an example,
Yes,
and don't have any family supports or loved ones close by.
that's correct.
Okay, and do they have to qualify financially for that?
No, they
No,
do not have
okay.
to. No, they do not.
Okay. All right. So that's the home delivered meals program. How many buses, if I may say, or transit vehicles are in your inventory?
Well, as far as buses, we probably have a cap of 80, but we have at least 125 vehicles.
That's amazing.
It is.
And that must be a job in and of itself to manage all of those vehicles from a maintenance perspective, et cetera.
It is. It is. It's a job. It's a job in itself.
Can you give the folks a sense of how many drivers we have at the agency?
We have at least 23 drivers right now.
Okay, all right. And for anyone who may be interested in opportunities to drive, to be a part of the transit team, I'm imagining that you would direct folks to our website that has the job opportunities listing.
Yes,
there.
please. We are looking for drivers.
Oh, you are?
We are
Okay.
looking for drivers, yes.
All right, that's fantastic. We will have that web address on the screen for you, that website address, in case you or someone you know may be interested in being a transit driver for our agency. And is that full-time, part-time?
Well, right now we're looking for 1 full-time and we several part-times.
Okay,
Several part-times.
wonderful. As you know, Shelby, May is Older Americans Month, and their theme is Powered by Connection. What does that mean to you in your role?
It means to me for belonging and caring. So everybody wants to feel like they belong to someone and also be cared.
Yes, absolutely. And I feel, I know some of the members of your team, and Shelby, you have an amazing team. There were folks there who have been there longer than you have been, right?
Absolutely, yes. Yes.
Into the 30s, maybe 30 plus years.
Right, yes, that is correct.
And folks just starting out, and everyone in between, right?
Yes.
And I think it's great. And their interactions, their connections, if you will, right, powered by connections with the individuals that they help transport is
Right.
priceless.
Yes, it is. It is priceless.
Is there anything else that you would like to add about the transit department?
It's just a great place to work. We have great drivers. We have it's you have to love what you do,
Yes.
and you have to love everything about the job. And that's about it.
And clearly you do, I can tell.
Yes, I do.
Thank you so much for joining us today.
Well, thank you for having me.
You're welcome. Well, folks, we have come full circle. We have Ray Parks with us again, Director of Community Connections for Older Adults at Encompass Community Supports. Ray, welcome back to the chair.
Thank you.
You're welcome. You have a fantastic team, by the way. I know you already know that.
I have to agree with you, yes.
So let's see. Let's talk about, as one topic, our 5 senior centers. We have one in each county that is within our area, and that would be Culpeper, Fauquier, Madison, Orange, and Rappahannock.
Absolutely, that's correct. And these senior centers technically are known as congregate nutrition sites, meaning that obviously people join together in groups and receive a meal. So that's the technical definition of what the senior centers do, but there's so much more than that. There's really 4 service areas, and I think each of these, to the theme of Older Americans Month, kind of promote connections, meaningful connections. And they're also very empowering as well for the individuals. And the first one I would talk about is just the nutrition component, which is actually a well-balanced hot noon meal that's served at each of the senior centers. And we know that sometimes older adults, especially if they become isolated, nutrition can decrease. And one of the things that's well known is that when people congregate and are in relationship and are having a good time, basically, they will tend to eat. And we're able to offer a very nutritious and balanced meal that's heart healthy.
Wonderful. You know, food is one of those universal languages, right?
Exactly. So there's that component, which is valuable in and of itself in terms of empowering. If you don't have nutrition, you can quickly go into a downward spiral, as we well know. And then the related component there is the socialization, recreation aspect. Each of our senior centers has a strong program of activities, and both people who come in from the community to provide educational programs, arts and crafts, music, just a variety of things, as well as the trips and outings that they can take as well through the resources we have.
Wonderful.
So that certainly helps connect people.
Ray, by the way, getting back to food, one of my favorite subjects, where does the food come from?
Glad you asked that question. We operate a central kitchen at our main office here in Culpeper, and the meals are prepared there for the senior centers and served hot.
Wonderful.
Transported by volunteers, by the way.
That's a lot of meals.
Yes, it's usually around 100 to 200 a day for the senior
Amazing.
centers.
Yes. So we have a catering kitchen on site, if you will.
Correct.
Yes. Not only do they cater or provide meals to all of the senior centers, but they also provide catering services out in the community.
Exactly. We do a little bit of external catering. As we have the capacity to do so, it brings in some revenue for our programs, as well as it's a good outreach for our agency to let people know who we are.
And staff are able to go down to the central kitchen, right, staff of our agency, to purchase their breakfasts or lunches, which is an amazing component, if I may say.
It's a great benefit to have the central kitchen, absolutely. Another aspect of the senior center programs is preventing disease, promoting health. There's a lot of educational programming that goes on, as well as exercise, getting people moving and active. Again, people are much more likely to do that in a congregate setting when they're among friends and have relationships.
And they
so-
feel more motivated.
Exactly.
I, for one, am not very motivated if I'm asked to go to a gym by no one, right? In other words, if I'm responsible for getting myself to a gym or taking a walk or what have you. But if friends come along, or people
Yes.
that are of like minds, right, then it's much easier.
And if it's fun. I mean, that's the other
Yes.
thing. People want to have fun. This is a voluntary program, so people need some incentive to be there and participate. And then finally, the other thing that our senior centers offer is opportunities for volunteer service. They are staffed with only one full-time employee and really depend on a strong base of volunteers to operate in all 5 counties. And many people who don't see themselves as senior center membership material will go if they see an opportunity to volunteer and be of help. In reality, it's the same thing. We're connecting and we're socializing and receiving
Exactly.
nutrition and all the same things. But that volunteer component is very important and gives people a sense of purpose. And there's some other volunteer sites that our agency places people at as well.
There's definitely something for everyone
Definitely.
within your division. Yes. Okay, speaking of getting people together for fun, I understand that there is a signature event coming up, our 14th annual.
Absolutely. We are getting ready for our 14th annual Bowl for Seniors on June the 22nd at Galaxy Strikes Bowling Center in Warrenton. This is a fun time for the whole family. People can get an hour of bowling and also door prizes, raffle tickets, lots of things going on. It's a great venue, and it is a signature fundraising event for us as well. So we
Yes.
invite everybody to come out for that and have a good time.
And if you register by June 5, you will receive a T-shirt. I know that. And we are also looking for sponsorships as well. So if you are an individual or a business out there, we have a variety of very reasonably priced sponsorships with great benefits. So we will be sure to put the contact information on the screen for Bowl for Seniors. I have to admit, Ray, I use those bumper rails or whatever they call those things because I'm not a very good bowler, and I search for the lightest bowling ball weight-wise. And the cool thing about Galaxy Strikes, folks, is that the bumpers, if I'm saying it correctly, are not these large inflatable things that make it obvious that you need bumpers, but they're little gates that come up and go down and come up and go down. So if I'm on a team and I need bumpers, they go up. If my teammate is really good and doesn't need bumpers, they go down.
Well, that's the nice thing about our Bowl for Seniors event. It's no judgment, no competition. It's just bowl for an hour, have fun, bring a little bit of sponsorship or pledges with you in the door to help the cause. And,
Absolutely.
And
Yes.
you're done.
To benefit the older adult community members here of Encompass Community Support. So again, 5 counties: Culpeper, Fauquier, Madison, Orange, and Rappahannock.
That's it.
So I understand there's a video coming up.
Yes, absolutely. I wanted folks to see this. This is produced, it's just about 2 minutes long, but it's produced by U.S. Aging, which is the National Association of Area Agencies on Aging, or AAAs like ours. We've been in business for over 50 years, and this is a great little summary of the impact we have in communities and a celebration of that 50 years of service.
Less than 2 minutes long, folks. Stay tuned, but in the meantime, I want to thank you, Ray, so much for you and your team members' support for this show, this episode today. Keep up the wonderful work, and you and your team are making a difference.
Thank you so much. I appreciate the opportunity.
Of course, absolutely. Well, folks, After the video, we're going to close up this episode of Community. So I want to thank you so much for staying with us today. I hope that you've learned so much about the many programs and services available for our older adults aged 60 years and older throughout our communities. I'm Tammy Barboza, and thank you again for watching. We'll see you next time.
It's time to celebrate. Since 1973, when Area Agencies on Aging, also called AAAs, were federally authorized in the Older Americans Act, these local leaders in aging have helped older adults age well in their homes and communities. Since then, AAAs have developed and delivered a range of home and community-based services that support older adults through meals, health and wellness programs, transportation, social engagement activities, health insurance counseling, and so much more. And as the nation's population of older adults continues to grow and their needs evolve, AAAs have met the challenge by expanding their programs to serve new populations, caregivers, people living with dementia, adults with disabilities, grand families, and others. AAAs have also formed new partnerships and expanded their reach to meet the needs of older adults in their communities. Partnerships with healthcare entities, public health departments, housing authorities, faith-based institutions, and so many others, all with the goal of supporting the ability of older adults to age where they want, at home and in their community. Working together, AAAs help ensure the nation's older adults can age well. Congratulations to you, Area Agencies on Aging, on 50 years of incredible service to our nation's older adults and caregivers. Here's to 50 more.